My name is Dianne Saunders. I'm an RN. I work at a local hospital.
My name is Michael Chapman. I'm a registered nurse. I've been a registered nurse for about 11 years here in the state of Tennessee as well as other states.
My name is Vanessa Robertson. I'm a labor and delivery technician at General Hospital at MASSEY in Nashville, Tennessee.
My name is Jeff Massey. I'm a respiratory therapist at Methodist Medical Center in Oak Ridge, Tennessee.
We've noticed an influx of patients who have just recently lost their jobs and as a result have lost their insurance. And it's difficult to take care of them. Okay, they can't afford medicine.
We know that in East Tennessee there are a lot of folks who are unemployed and uninsured right now, and therefore they go without the medication that they need. They're sick people. The sickness doesn't go away because the insurance isn't there. So what they do is they wait until it's an absolute emergency. They wait until it's a have to. I have to go to the emergency room.
When I hear people say that they don't want to go to the hospital because they can't afford it, it tears me up. Because I'm just like, I don't know, what can I do?
Well, there needs to be an option that allows for every American to have health care insurance.
I've watched patients' blood pressure rise. I'm like, you take the blood pressure, it's 220 over 130. Well, did you take your blood pressure medicine? No. Well, how long have you been out? Oh, a month. No, longer. Well, why? Because I don't have any money.
Why should I go? Because by the time I get through paying a premium, having to pay a copay, a deductible, medications, and I don't have, what do I have left? No one should be afraid to go to the doctor because they're not going to be able to pay for health care.
At one point in my career, I had a patient who, due to long-standing diabetic issues, hypertension issues, which ultimately resulted in pulmonary issues or problems with her lungs, ended up on a ventilator, ended up ultimately with a tracheostomy, and had this individual had adequate insurance, they could have transitioned from the hospital environment where they were eventually, they were off of the ventilator, they had a tracheostomy, and could have went home with her, returned to home, live with her daughter and her grandchildren. However, because of her particular healthcare needs and her lack of insurance, which is the key point, she was not able to return to home. She ended up having to be placed in a skilled nursing facility. She was, because of lack of insurance again, destitute to living in a hospital environment for the time that she had left.
You know, I've had a family member who never went to the doctor, and when they end up going to the hospital because they had so much pain, cancer was all over their body, and the doctor only gave them a week to live.
A lot of them are used in emergency rooms, you know, for something like a sore throat. But they have no choice because they can't afford to go to the doctor. So the healthcare cost is going to go higher and higher because the emergency room is the only place they have. And if we're not there, where are they going to go?
They sometimes could possibly go to their physicians, which would cost less. But when they come to the emergency room, it's a huge expense right off the bat. And when they get to the emergency room, they're usually so critically ill at that point that it takes a lot more intervention on our part.
Affordability, universal access, as well as care that provides for both pre-hospitalization, hospitalization, and post-hospitalization. That healthcare reform is truly a nonpartisan issue in the sense that it's not a Republican problem, it's not a Democratic problem, it's a people problem.
This is a serious matter.
If we don't have our voice heard, they're not going to know what we need.
We need universal insurance, okay? The insurance companies are for themselves, not for people. They're for themselves to make that buck. But I feel that everybody deserves health care. Everybody.